Hello, my name is Dr. Kevin Yip. I'm an orthopedic surgeon and I practice in Gleneagles Medical Center. Today we're going to talk about the conditions affecting the lower limb. Now then, one of the most common problems that we encounter in the ankles and foot are a condition called plantar fasciitis. Now in this condition, the patient often presents with pain to the bottom of the heel. And this is usually most painful first thing in the morning when they get up immediately from the beds, and in the first 10 minutes they often feel excruciating pain to the bottom of the heel. Now then, usually at the early stage of these conditions, the pain usually will subside after 15 minutes once they're out of the bed. But many patients will also continue to complain of pain with prolonged walking as well. And as the condition progresses, they may feel pain all the time at the bottom of their feet. Now then, what are the reasons for this? Well, first of all, we need to look at the anatomy of the foot. Now then, if we look at the anatomy of the foot, we see that at the bottom of our feet there is a sheet of tissues known as the plantar fascia. Now this tissues is quite specialized in that it is only found at the bottom of our feet or the palmar surface of our hands. Its main function is to bind the skin to the underlying tissues such that it provides a better grip for our hands and feet. Now this tissues is also attached to the heel bone. Now then, with the condition called plantar fasciitis, there is often some degenerative changes to this connective tissues or the plantar fascia, and resulting in chronic inflammation. And that these conditions will present itself with pain to the bottom of the heel, and that this is where the patient would feel the pain. Now then, the treatments for this particular common condition called plantar fasciitis, there you can divide all the treatments into two groups. One will be the so-called home remedies type, and then the other types where it involves more and it has to be done in the clinic. Now then, in terms of treating this at home, it is possible to treat this by using something like this called a heel cup. Now this is made out of silicone gel, and you put this at the bottom of the inside our shoes, and that will certainly help to cushion the force and hence to reduce the pain. At night after work, when we feel a lot of pain at the bottom of our heels, another way is actually to put a hot cold pack like this and that one can put this in the freezer, and once it's reaches 0 degrees, we can use this as an ice pack, and we put this at the bottom of our foot, and that will certainly would help to reduce the inflammation. Other exercise that one can do at home includes stretching exercise. Now then, these will certainly be relatively simple methods of treating these conditions, but the effectiveness is not a lot, but it will help those cases with mild degrees of plantar fasciitis. Now then, if the condition persists for some weeks and is still bothering the patients, then I would say that one way of treating this would be to come to see a doctor, and after the initial investigations, one can then proceed on to having an injection. An injection will certainly would help to reduce the symptoms quite dramatically within a few days. It is a relatively simple procedure which can be done in a clinic setting. Other forms of treatments include the use of shockwave therapy. Now, shockwave therapy is a way of delivering high energy sound waves to the bottom of our feet. It is concentrated sound energy that will help to promote the healing process of the plantar fasciitis. And that with this method, it is done under local anesthesia, and that it works by promoting the healing process, and at the same time to break up the scar tissues at the bottom of our feet. and this will tend to alleviate the symptoms of plantar fasciitis.